Hello, I'm Dr. Zubia, and we and Dr. Sabine Musarat are recording the case-based discussion on the post-mortem examination. So we are starting the case now. Hello, I'm Dr. Zubia, one of the doctor in the clinic today. Am I talking to Sarah Peter?
Yes.
I'm so sorry, Sarah, that we are meeting in such a difficult circumstances. Please accept my condolences on the sad demise of your baby.
Okay, thank you.
How are you coping up after this?
I'm trying to absorb this still.
I'm really sorry. This must be a difficult situation for you.
Yes.
Sarah, today I'm here to explain you regarding the post-mortem examination that can help us to find out the cause of your baby's death. Am I clear to
Hmm.
you?
Yeah, something doctor told me about it. I I really don't know.
Sarah, is it the right time to talk to you at the moment?
Yes.
Okay. Sarah, I need to ask you a few of the questions that might bring the bad memories, but this is going to help us to find out the why this has happened and what have been done to avoid in the future. Can I proceed?
Mhm. Yes.
Okay. Sarah, can you tell me about how's the recovery since delivery?
Yeah, it's good. I'm okay.
Mhm. Did you get the chance to see the baby or hold the baby?
Yeah, I saw her.
Did you named her?
Yeah, she's Lisa.
Okay. Sarah, so how are you have you been since delivery? Do you have any pain down below?
Yes, still I have little pain there in my stitches.
Any bleeding?
Not now.
Do you have any pain in your breast?
Yes.
Hmm. Have you passed urine?
Yeah.
Hmm. And have you opened your bowels as well?
Yes.
Okay. Can you please tell me about your pregnancy? How was that?
It was a low risk pregnancy. I was with my midwife. I was not aware of any bad thing in my pregnancy.
Okay.
What did why did it go wrong like this?
Okay, okay. Thank you for providing this. So, do you have any raised blood pressure during the pregnancy?
No,
And
not at all.
any history of clots in you or you in your family?
No,
Okay. And do you had any history of fever or flu-like illness during the pregnancy?
no,
Okay. Sarah, please tell me, do you smoke or drink alcohol?
no,
Okay. Do you have any medical condition that I should know of?
no,
Okay. Do you have any family history of any genetic condition?
no,
Any allergies?
no.
Mhm. Are you aware of your blood group?
Yeah, it's O positive.
Okay. Okay, thank you, Sarah, for providing me all this information. Do you want to add in anything else?
No, I just want to know why it happened. It was just the bleeding, and I came like within time in hospital, and they said me that there is bleeding and we cannot hear your baby's heart. So me and my partner, we were really looking forward this pregnancy. I don't know what happened, what did go wrong.
Really sorry to hear about this. So, Sarah, just to tell you about this, that the post-mortem examination, actually, what we are going to do is that in which we need to see that a thorough examination from the for the of the baby, and also it will be done by the specialist that we call the perinatal pathologists are going to do this test, and the baby, the Lisa, will be dealt with utmost dignity and respect all the time. Okay, in this
But
examination,
i'm
yes.
I'm really bothered because Lisa will have cuts over her body, and we don't want any cuts on my baby's body.
I do understand, I do understand, Sarah. We will make sure that the cuts that were given will be stitched back properly. The Lisa will be dealt with utmost dignity, and she will be covered with blankets, and the cuts will be stitched back properly. Okay.
Okay.
Yeah, so let me tell you about that. This type of test that we are going to do, this post-mortem examination, basically is there are three types. One is the complete one, in which we do the head-to-toe examination of the baby, in which all the body organs like brain, lungs, and heart will be examined, and tissue samples will be taken from these different organs, and they are sent to the
Mm.
laboratory. And then to find out the cause, and we need to communicate with you regarding the result in 6 to 8 weeks time. I
Okay.
clear to you.
Okay. Yeah.
All these type of tests will be done with your consent. So I'm going to provide you
Mm.
the all the information. Then you and your partner can decide whatever you will decide. We are here to support you in that. Okay.
Mm-hmm. Mm-hmm.
So like the other one is the, if you are not willing for the complete test, complete postmortem examination, the other one is the limited type, in which we you can choose which organ you want your baby to be examined. So like chest, tummy, or neck. So this will be decided by you. Then the third one is the external type, in which we may do some of the X-rays, and only the imagings will be done, and there will be no cuts that will be given to the baby. These are the three types of post-mortem examination that we can offer you. Okay, but each of them has its own limitations and own pros and cons. And all these kind of tests will will not completely tell us about the cause, because sometimes we cannot find out the cause in half of the babies as well. Am I clear
Okay.
to you?
Yeah. So I will think over it. I will discuss with my partner, and then we will decide, because we we are in pain at the moment.
Yes,
Let me decide about it.
yes, sure, Sarah, you can decide, and yeah, we are here to, like, whatever you will decide, we are here to support you in that. But let me tell you one thing, Sarah, that earlier you will decide, better it will be, because the once the baby will go some changes in appearance, then the result will be affected by this. So
Okay.
it will be better if you sooner
Mhm.
will decide, and then
Okay.
after once you will decide, then we will sign a written consent from you.
Mm-hmm. Mm-hmm.
Okay.
Okay. Mm.
And apart from this test, we need to run few tests on you as well, to see the that any other comorbidities, if you have like any diabetes, thyroid disease,
Mm.
as well as liver and kidney disease, that we need to see, as well as we need to see, do the infection screening, and the screening like to see the clots in the formation in the legs and lungs. So we need to run few tests on you as well. And also there are some tests that we take the samples from the afterbirth and the cord of the baby as well. Am I clear?
So will you do all of my tests now?
We are going to wait for some time. After 6 weeks, we'll do some test, and we'll communicate accordingly. Okay.
Okay. Okay.
Also, the clinical geneticist will do the genetic testing of your baby as well, to find out the genetic makeup. Okay.
Mm-hmm. Okay.
So these are some tests that we are going to offer. And also one more thing, Sarah, that I want to tell you, that these tissue samples, we can save it for the future medical as a medical record as well, for future examination, if you allow.
Okay. I will not permit for that, I think.
Okay, okay, Lisa, no problem. We respect your wishes, and if you don't allow, we have the proper management for the disposal, tissue disposal as well. So my colleague
Mm.
will going to tell you about that. Okay,
Okay. Mm-hmm.
and also if you want, you can take some of the mementos and memories of the baby, like the footprint or the handprint or the baby's hair, that can be kept for the memory. Okay.
Okay. All right.
And also, Sarah, I want to tell you about the funeral services that are available according to your religious and ethical beliefs. So, if you want, you can be avail that service over here, so we can provide you the information about this.
Okay.
Am I clear to you?
Yes.
Okay. And in case if you have any problem in, like, in the pain in the breast, we can offer you some of the measures to reduce for the milk suppression as well, if you want. And also, I'll connect you with the SANS group that will be helpful to support you. And the I'll give you the written information leaflet regarding what we have discussed so far.
Okay.
Okay.
Okay, doctor.
Okay, Sarah, one more thing that we are going to initiate the incidents report to find out the what happened exactly happened to the Lisa, and we need to register
Mm.
this baby to the stillbirth registry. Okay, either you do or healthcare professional will do it for you.
Okay.
Am I clear to you?
Yes.
Okay, so Sarah, once you will go home, if you feel like you are unwell, we are providing you with the 24/7 detail. You can come back, and also I will be providing you with the follow-up appointment with my consultant. Is that clear?
Mhm.
Sarah, do you want to ask
Yeah.
anything?
It's no, it's clear to me.
Okay, Sarah. So I'll now connect you with the psychological counselor as well. That will be helpful to alleviate your condition. Okay.
Okay, thank you.
Thank you, Sarah, for your time.
Okay, thank you.
Okay, now we will discuss some of the important points regarding this postmortem examination. One thing is that this is a consent form that can be provided to you, but you don't need to sign it, this consent form at the moment, but just for the information that is given to you. The other thing is that first of all in this scenario we need to give some first of all initiate the patient, the role player, with the introduce her with the name because she is already admitted patient, so greet and introduction is important. Then rapport building, that we need to the ask about that how she's feeling at the moment. Also the we are going to talk that about the support, that whether she has enough support at home when husband or partner is around. And then we need to offer condolence. That is very important. With a softened voice we need to be very empathetic and offer the condolences, that the I came to know about your loss or something like that, that please accept my condolence. Then we have to ask about the baby so that the rapport building will be done. Then the baby's name is important, offer counselor services, and then fix the agenda. You after this, after doing all this, we need to ask for the consent for the information gathering, and we need to just ask about the targeted relevant history, about the pain, how was the patient doing after the delivery, like pain, bleeding, episiotomy, as well as the we need to ask about the bowel and the bladder difficulties if she has, and also about the pregnancy in detail. That the in pregnancy we can ask about the that whether it was an uneventful pregnancy or eventful. Then accordingly we need to ask about rule out hypertension, diabetes, and some of the causes of the stillbirth. Then the routine history of the obstetrical, medical, surgical, family history of genetic diseases is important. Allergies to rule out, and also the then we need to thank her and for the providing all the information, and if she wants to add anything. So this is all about the information gathering. Then if she has any notes, then we can ask about to review the note, permission to review the notes about the pregnancy and the events that has occurred. Then regarding the applied clinical knowledge in this scenario, first of all, we need to explain her about what postmortem examination is, that it is a thorough examination of the baby, and also it is carried by the specialized doctor called the perinatal pathologist. Then explain the limitations, that a baby dying in the womb occurs in 1 in 200 of the pregnancies, but in half of the cases we couldn't find out the cause. So coming to the postmortem examination, types of postmortem examination is complete, limited, and the external. So we will discuss one by one. The complete one is this gives information regarding the external examination, examining the internal organs, taking X-rays and ultrasound, examining small samples of tissues under a microscope to find out what could be the cause. Then limited postmortem examination includes the less information than a complete one, but it can in which we choose the organ or tissue of the baby to be examined. Then the external postmortem examination includes the careful examination of the outside of the baby's body, X-ray and medical photographs, in which no incisions or cuts will be given. So these are the three types of postmortem examination. Now, after that, we need to mention about the tissue sampling, that these tissue samples can be may appear in the future. So advanced tests can appear in the future. So we may keep some of the tissue samples for future examination as a medical record with your consent. If she allows, then it's okay. We need to give her information regarding the tissue disposal as well, that we'll also discuss regarding the proper disposal of the tissue sample if you don't want to keep it for the medical record. Now coming to the other test that we offer is the maternal test to rule out the comorbidities like diabetes, thyroid, liver and kidney test, infection screening, and thrombophilia screening as well. Now the placenta and cord will be examined, and the karyotyping will be done by the clinical geneticist. And the results will be communicated within 6 to 12 weeks time. Written consent will be taken once she will decide with the partner, or she wants to discuss or take some time. But we need to mention the limitations, that this is important, that earlier the autopsy should be done, better the chances of identifying the cause, as the baby will go certain changes in appearance with the passage of time. We will offer her to take mementos that she can keep, body hairs, footprints for the memory of the baby, funeral services to be offered, contraception advice can be given, lactation suppression, NTD in case if the blood group is negative. Next pregnancy should be in the consultant-led unit, SAND support group offered, named midwife, and the registrar in the stillbirth registry will be given. Incidence report to be initiated, follow-up appointment with the consultant and the psychological counselor will be given, red flag signs to be explained, and give emergency contact detail. Also, we will give her the patient information leaflet and document what we have discussed, involve the GP in the loop, and then thank her. Coming to the main important thing is that communication with the colleague part, we need to involve the senior consultant for another debrief session if you want, lies with clinical psychologists and bereavement nurses, include the geneticist for karyotyping, involve perinatal pathologists to carry out the post-mortem examination of the baby, and reach out the GP and the social work for support. So these are the people we need to communicate in a team to cover the communication with the colleague domain. Now, the patient's safety in this scenario includes that we need to confirm the patient's identity, rule out the allergies for safe prescription if she wants any lactation suppression or any other medication, ensure the awareness of what tests are done and what is needed, provide information regarding the support group, the TOMI and the SAND group, discuss the red flag signs and symptoms regarding her health, bleeding, pain, and the fever, and give her the emergency contact detail, arrange the home visit by the midwife, counselor, and other support team, and we discuss and we give her chance to rediscussion with the partner if she wants to discuss again. So this is all about this scenario. Anything, Dr. Sabine, if you want to add, then otherwise we will wind up the session.
Okay, so thank you so much. And there is nothing much to add in this whole case discussion. It was all about the postmortem. I just want to add here that this is the scenario of postmortem, and this woman will be really upset. She might be crying, or she may just be silent. She will not say anything. So it is not necessary to complete everything until end. The examiner will look at your communication skills here and at your empathy. So please use your empathy like a lot in this station. Try to build up rapport with the women who is upset. Don't consider that you need to say everything regardless of looking at her expression. So particularly in the postpartum situation, when patient is having an IUFD, just go along with the patient and just give your time to her. Give pauses to your consultation to absorb things for her, and let her speak, let her discuss her concerns, and then go along with those concerns. So this will be overall impression of your consultation, no matter you have completed or you have not. But the main thing is empathy, and your communication, your softer voice will count. That's all. Thank you, and good luck for your exam.
Okay, thank you so much, all of you.